In this video, I will continue explaining the first subtopic under pain, which is types and theories of pain. In the previous video, I've talked about the definition of pain and the types of pain, which are acute and chronic pain, which are further subdivided into organic pain and psychogenic pain. In this video, I'll talk about the next one, which is theories of pain. Okay, so there are two theories of pain: specificity theory and gate control theory. Theories of pain is basically talking about explaining about how our body experiences pain. So what happens in our body that makes us experience pain? Okay, so these are the two theories. As you can see, the specificity theory is one of the first theory, as it was developed in 1664. And then there's gate control theory, which was developed in 1965. So what is specificity theory? It's actually the first theory ever developed on how people experience pain, which was developed by Descartes in 1660, what was it? 1664. In this theory, it argues that the body has a separate sensory system for perceiving pain, just as it does for hearing and vision. And this system contains its own special receptors for detecting pain stimuli and its own area of the brain for processing pain signals. So I think you have learned in biology how there are different receptors under your skin for different sensory. So for example, here there's a receptor for touch, which is called, I don't even want to try. Okay, there's a receptor for pressure. There's a receptor for different receptors for touch, and then according to this theory, there is one specifically for pain. So according to this theory, basically, here's a more clearer picture. So if there is a cut here, let's say there's a paper cut here, so this pain receptor will detect it. Okay, so what happens after it detects the painful stimuli, which is the paper cut? Okay, so for example, here there's a fire. So when a noxious event, in this case it's fire, it stimulates a pain receptor, and which then sends signals down the neural fibers, okay, to the pain center in the brain, right there. And the brain will then now process it and perceive it as pain, okay, which enables us to react. Okay, so basically there's a painful stimuli. Here, the painful stimuli is heat, where there's a fire, and your toes, the receptors under your skin in your toes, detects it and send the signals down the neural fibers to the pain center in the brain. Now, this is important as you need to include it in your descriptive essay. Okay, here's another example. Okay, when there's a nail, okay, on your finger, so the pain receptors in your finger, in the skin, are activated by the tissue damage caused by the nail. Then the signal travels up the peripheral nerve to the spinal cord, and then the spinal cord will send it to the brain, and where your brain will perceive it as painful. Okay? Okay. According to this theory, the intensity of pain, how painful it is directly related to the amount of tissue damage. Okay, so if there is a large tissue damage, and then the receptor will consider it as really painful. Okay, so for example, here, pricking a finger with a needle compared to cutting off a finger with a knife, obviously pricking finger with a needle creates smaller tissue damage compared to cutting off your finger with a knife. So here the receptors will send different signals to the brain, and therefore this incident here will be considered as more painful as there is more tissue damage. Okay, so this theory is accurate when applied to certain types of injuries and acute pain associated with them. So the smaller the tissue damage, the less painful it is. Okay. However, it assumes that if surgery or medication can eliminate the cause, then pain will disappear. So for example, there is a cut and then you go into surgery to stitch it up, so therefore there is less tissue damage once you stitch it up, so the pain will disappear. But however, this does not explain the cause for chronic pain. You know, when you have a headache, when you take medicine, somehow you feel better, but the medicine does not treat any tissue damage because there was no tissue damage in the first place. But how does it lessen the pain? Okay, so it doesn't really explain it. Okay, it also cannot account for phantom limb as there's no ongoing tissue injury. So when there is no leg over there, there's no tissue damage, but why can they still feel the pain? So there's something wrong with this theory as it only looks at and considers biological factors, which is physical, which is tissue damage will cause pain. Okay, it doesn't account for phantom limb pain as well as chronic pain such as headache. Okay, that's why there's this theory, which is gait control theory. Before I talk about gait control theory, let me talk biology to you. Okay, so the nervous system is made out of the central nervous system, the spinal cord and the brain, and the peripheral nervous system, the nerves outside of the brain and spinal cord. So this is the central nervous system, this is the peripheral nervous system. So here the nerves help send message to the central nervous system. In the gait control theory, the experience of pain depends on an interplay of these two systems as they each process pain signals in their own way. According to the theory, the spinal cord here contains a neurological gate that can either block pain signals or allow them to continue. Okay, let me just talk to you about where the gate is located first. Okay, so let's say here there's a spinal cord there. Let's say you cut across the spinal cord along that line. This is what it will look like. Okay, which shows the dorsal horn. Okay, now the gate is actually inside the dorsal horn. Okay, now what happens? So what does this gate actually do? Okay, upon injury, pain messages originates in nerve associated with the damaged tissue and flow along the peripheral nerves to the spinal cord and up to the brain. Before the pain messages can reach the brain, these pain messages encounter nerve gate, just now what we talked about in the spinal cord, that open or close depending upon a number of factors. When the gates are open, pain messages get through more or less easily and pain can be intense. When the gates close, pain messages are prevented from reaching the brain and may not even be experienced. Again, you need to include this in your descriptive essay. Okay, so what is the passage here? So let's say there's a painful stimulus. Okay, painful stimulus in the nerve, there's a tissue damage. So it sends the signals down to the spinal cord where there's a gate. Okay, now if it's open, if the gate is open, it will allow the pain signal to reach the brain where you will perceive it as pain. But there are cases where the gate is closed, and I will explain to you what causes it to close in a bit. Okay, so according to the gate theory, there are three factors that affect our experience of pain and opening and closing of the gate. 1. The amount of activity in the small nerve fibers. 2. The amount of activity in the large nerve fibers. And 3. Messages that descend from the brain. Okay, so this is what happens. Let's say there's a painful stimulus. Okay, so for example, paper cut. So this will activate small nerve fibers, which will open the gate in the spinal cord, which will then send signals to the brain. Okay, where the brain will interpret it as painful. Okay, so if it's a painful stimulus, it activates small nerve fibers, which opens the gate in the spinal cord, which sends signals to the brain. If it's a non-painful stimulus, let's say someone holding your hand, okay, this will activate large nerve fibers, which closes the gate, which then reduce the pain signal in the brain. I know it's a lot to take in. Okay, just try to remember. Painful stimulus activates small nerve fibers, which opens the gate. Non-painful stimulus activates large nerve fibers, which closes the gate. Okay, here, this experiment will explain to you better about the process, okay, the opening and closing of the gate. Now, let's try smacking the back of your hand with your dominant hand. Let's say your dominant hand is your right hand. I want you to hit really hard the back of your left hand. Give it a go. Now, What is your immediate reaction after? Did you rub the back of your hand after it was hit? Now, rubbing or shaking after a hit, which is non-painful stimulus, activates large nerve fiber, remember, which closes the gate. So therefore reduce the perception of pain. Okay, so at first, when you hit the hand, first place, which is a painful stimulus, it activates small nerve fibers, which opens the gate and which then sends signal to the brain as pain. When you rub it, it is now a non-painful stimulus which activates large nerve fibers, which closes the gate that was open in the first place, therefore reducing the pain signal. I hope that is clear for you. Okay, so there is now an explanation for why you do these things after you get hit. Okay, it's either you rub it or you shake it. Okay, now, so there's that. So one thing that can open and close the gate is again the amount of activity in the small nerve fiber and the amount of activity in the large nerve fiber. And we can see that if there's more activity in the small nerve fiber, which is activated by painful stimulus, it is considered painful. If there's more activity in the large nerve fibers, which is activated by non-painful stimulus, so in this case just now was rubbing your hand, it becomes less painful. Okay, another thing that can affect the opening and the closing of the gate is messages that descend from the brain. These include information such as excitement and anxiety can affect how much the gate is open or closed as well. Okay, so if you're excited or if you're anxious, so for example when you're playing sports, right, and then you twist your ankle while you're playing the game, you don't really feel the pain, do you? But once the game finish, then the pain hits. So why didn't you experience the pain when it was happening? It's because you were excited. There was adrenaline rush then. So your brain is sending message to the spinal cord to close the gate, okay, so that you can continue on playing. Okay. So messages from the brain can also either open or close the gate. So what can cause it to open? So for example, if you are really bored or if you focus too much on the pain, then you're telling your brain to send a message to the spinal cord to open it. Okay, which then becomes more painful if you really focus on it. Okay, so because your brain is sending a message to the spinal cord to open the gate. Okay? Or if you are anxious and if you are depressed, tension, this can cause your brain to send a message to the gate to open. Therefore, you perceive it as painful. However, have you ever used the term laugh it off? Laugh it off. So when you fall down and they say just laugh it off, or shake it off, shake it off, shake it off. So you are telling you are trying to set a positive emotion, okay, or you are trying to distract it, okay. So this causes the brain to send a message to the spinal cord to close the gate, therefore less pain is experienced. Okay, so these are some of the conditions that can open the gate and close the gate. Okay, so this theory is actually good because it includes biological and psychological factors in pain experience. So it's more holistic compared to specificity theory, which was just biological factors. Okay, where pain is caused by tissue damage only. Okay, but here in this theory, pain is an interaction between the mind and the body, where the pain can be shut off, or where you can tell the brain to send a message to the spinal cord to close the gate. Okay, it can also account for phantom limb pain, as there is no ongoing tissue injury, but psychological factors may cause the experience of pain. So, for example, here when you're depressed, okay, somehow your brain is sending a message to the spinal cord to open the gate, which causes you to feel pain when in fact there's no tissue damage. Okay, so you can see already which one is the better theory, and that's it for the first subtopic, which is types and theories of pain. Thank you.